I'm Anthony Johnson. I'm a registered nurse, so I tend to do work in the community, usually as a health visitor, but I'm also the lead organiser for Nurses United UK.
And what's been your experience of being a nurse over the last 6 months?
It's been one where you've seen all of nurses and all of NHS professionals get together and support each other. It's been one where people have been working to defeat COVID because we were asked to stand up to those responsibilities, and we did. But it's also been one where this government has decided not to value us, not to care for us, and we need to have more than claps if we're going to be able to protect people before there's a second wave. We need to actually invest in the NHS again.
How has COVID affected your home life within the last 6 months?
But it's made it really stressful, and it's put loads of pressure on me to be able to even see families or friends. I think what we're seeing is that it's just changing the dynamics all the time of the way that we live and work together. And I mean, I've got people who I know and work with who are nurses where they've not been able to see the children for 6 weeks during the pressures of COVID, and they had to send their children away to go stay with grandparents or other relatives. And it's not the situation that we should be in. But we've done our part as health professionals. We've stuck to the mark and done what we were supposed to do.
After hearing that Chancellor Rishi Sunak was to give up to a 3.1% wage increase to 9,000 frontline staff, how did it feel when nurses weren't included?
It was disappointing because nurses on average have lost 20% of their wage since 2010, and in a time when the NHS already had shaky foundations pre-COVID. We already had 44,000 vacancies. We were already struggling to be able to survive when we're at work. It's not great for the government to be able to exclude nurses or any NHS professional and to not treat us fairly, which is why we're out here protesting today, because this is the only way we're going to get things done.
So the government said that nurses weren't included in the new deal after their deal for better pay in 2018.
I mean, the reality is that if low pay is causing massive vacancies, which is putting patients and NHS staff at risk, because we need to remember that 450 NHS health and social care professionals have died, it means that the government needs to invest in it. And it's a bit ironic that the people who have given themselves inflation covering increases over the last 10 years and haven't lost money like nurses have are the ones that are going into lecturing us and deciding whether or not we are actually able to pay our bills or even have to go to food banks. That's why they need to invest in these services, because people are getting burnt out and we're not going to stay otherwise.